As COVID rates hit all-time highs in the States and other countries go into lockdown, news of 2 new vaccines have given us a glimmer of hope. So has the fact that incoming administration has experts like our next guest joining the fight. Please welcome President Obama's former Surgeon General, Vivek Murthy. And he's going to be working with President-elect Biden on the coronavirus task force. So please welcome Dr. Vivek, Murthy. Dr. Murthy, I'm sorry.
That's okay.
Looking at stuff
Don't worry
and
about
I'm
it.
not seeing it.
It's all good. It's good to be here with you.
I'm glad you're with us. Listen, Pfizer said that their vaccine is 95% effective, and they plan to apply for emergency authorization from the Food and Drug Administration within days. Is this really good news, or should we be concerned about any of this? Give us a reality check about the realities of all of these drugs.
Absolutely. Well, absolutely, Whoopi. Let's talk about the vaccine. And it's really good to be with all of you today to talk about the COVID situation that we're in. Let's start with the vaccine. So the news that we've heard over the last few weeks about 2 vaccines, about the Moderna vaccine and the Pfizer vaccine, this is genuinely good news. And what we heard from both companies is that their vaccine candidates were around 95% effective in preventing cases of COVID-19. So we couldn't really have asked for a better preliminary result than this one. But this doesn't mean that we're done, because what we now need to do is make sure the FDA reviews that data so independent scientists can look at it and make sure this vaccine is both effective and safe. And we've got to work on the big challenge of distributing it. You know, what makes a vaccine a vaccination is the whole process of getting it to your community and into your arm. And that's not a simple process. To do this will require the most ambitious vaccination campaign that we have executed in the country's history. And so we're up to the task, but it's going to be a lot of work.
Dr. Murthy, the White House is refusing to let the head of Operation Warp Speed have contact with the Biden transition team, even though they want to. How greatly are your efforts being hampered? Biden says more people may die if we don't coordinate on plans to distribute vaccines.
Well, it's absolutely essential that we coordinate. What happens during every transition between administrations is that the incoming team works closely with the outgoing team, and they start that process as soon as possible. And the reason is really twofold. One is because there's a lot of information to share that can help make the incoming team's plans even sharper and more effective. But the second reason is that many of the people in the outgoing administration are actually career officials who will still be there during the next administration. So you need to start that working relationship with them early. Fortunately, myself and many others have relationships with people in the building. We worked with them because many of us have served in federal government, but there's no substitute to getting started talking with them, collaborating with them. Cooperation is really essential right now, and we're really eager for that process to get started.
Dr. Murthy, we've heard words like grim and unrelenting when it comes to this virus, and there's talk of our medical systems collapsing and hospitals potentially being overrun. I've even read that Doctors Without Borders are sending resources to the United States here. What exactly do you expect in the next few weeks? What should we be bracing for?
Well, Sunny, it's a good question, and I'm worried about the next few weeks because here's what we know from our experience with this virus. We know that first cases rise, then hospitalizations rise, and then the death count increases. And we're seeing cases still skyrocketing, which means that we still have potentially a worsening situation when it comes to hospital capacity, and there will be more deaths, unfortunately, to come as well. And that's very worrisome. And it's, particularly worrisome because of something we don't talk about nearly as often, which is not only the toll on people in our community, but the toll on health workers. These are my friends, my colleagues. I've worked closely with many of these people around the country over the years. They're tough men and women. They've taken care of victims of the Boston Marathon bombing, trail derailments. They worked in Iraq and Afghanistan, taking care of people who've been wounded in the theater of war. But they are really struggling right now after months and months and months of dealing on the front lines with this pandemic. They can't understand why people aren't wearing masks. They can't understand why we're not doing more as a country. And this will stand as one of the greatest tolls of this pandemic, is the psychological strain and trauma it's causing our healthcare workers.
they are the angels and the saints, Doctor. So we're a week away from Thanksgiving. So give it to us straight, okay? What do you say to people who insist that they want to have company and family and friends over next week? Because the current administration's so-called COVID advisor, Dr. Scott Atlas, said that they should invite elderly relatives because it could be their last Thanksgiving. What do you say to that?
Well, I think it's good as we think about Thanksgiving to try to use science to guide our decision making here. And let me just say from the outset, I know people are tired. We've been at this for many months now, and a lot of people have turned their lives upside down. It's the holidays. People just want to see their friends and their family, the people they love. I get that. I want to see my family too. But here's why I'm worried, because we have seen in the past that when holiday weekends come, Memorial Day weekend, Labor Day weekend, and people get together, we've seen the spread worsen after that. So we've got to be really careful this holiday season. And keep in mind, we've got a vaccine, it's more than one vaccine candidate that are just around the corner. So this is not an issue we're going to hopefully have to deal with for years and years. We're talking about on the order of months before we can get a vaccine. For this holiday, if you're thinking about getting together with people outside your bubble, one, think about whether there are people you're getting together with who may be in high risk, people who are older than 65, who may have conditions like diabetes or heart disease. And if you're going to get together, what you really need to do is keep it small. Limit your groups to no more than 10 people, and ideally much fewer than that. Wear a mask at all times. Maintain distance of more than 6 feet. Do your Thanksgiving dinner outside if it's possible. And I know some of you may wonder, well, how can I eat, Thanksgiving dinner with the mask on? Well, especially when you have your mask off, that it's especially important to keep distance and be in well-ventilated spaces. If you look at all this and you say, gosh, that's just too hard to do, then I would really reconsider whether you get together with family this year. Hopefully we'll have a much better Thanksgiving next year, but if we buckle down now, we can keep people safe and save lives.